Assalamu alaikum. Today I would like to discuss about neurocutaneous disorders. Very high yield topic. Okay, start with this neurofibromatosis. This is the calf-all-late spot. This is a hyperpigmented spot. Think about coffee, which if coffee drops in your shirt or if coffee drops in your dress, what will happen? There may be hyperpigmentation. S- So hyperpigmented calf or late spot. This is the cutaneous neurofibroma. This one is leash nodule. So neurofibromatosis type 1. if we can If we want to remember the neurofibromatosis type 1, we can remember these mnemonic cyclops, cutaneous neurofibroma, intellectual disability, calf or late spot, leash nodule, optic glioma, pheochromocytoma. There may be scoliosis. So, calf or late spot, intellectual disability, intellectual problem, cutaneous neurofibroma, leash nodule, optic glioma, pheochromocytoma, there may be scoliosis, and there are some other things like axillary and inguinal frickling. There may be pseudoarthrosis. For P, there is pseudoarthrosis. P is pheochromocytoma, and there is pseudoarthrosis. Yearly ophthalmologic examination screen for optic glioma and MRI of the brain and orbit is required for any vision change. So yearly ophthalmic examination for screen for optic glioma and MRI of the brain of the orbit is required for any vision change. So neurofibromatosis type 1, type 2 for all the tumors, and what I have talked about, this is type 1. This is type 2, neurofibromatosis type 2, NF gene on neurofibromatosis is autosomal dominant, and NF2 gene chromosome 22 on Merlin variable expressibility as it is autosomal dominant and easily age 20 to 30. Type 2 is a tumor, like a tumor in various area like schwannoma, vestibular bilateral vestibular schwannoma. There may be intracranial meningioma. There may be spinal tumor, schwannoma, ependymoma. There may be cutaneous tumor or skin plaques. So type 2 for tumor. There may be schwannoma, there may be meningioma, there may be other spinal tumor like ependymoma, and in type 2 there is cataract. Tumor surveillance, for tumor surveillance to look for schwannoma, to look for meningioma, we need tumor surveillance. That's why we need to do audiogram, ophthalmic evaluation, yearly ophthalmic evaluation for optic glioma, to look for optic glioma, and MRI of the brain and the spine for any is required for any vision change. Okay, now tuberous sclerosis, a very high yield. Tuberous sclerosis is a neurocutaneous disorder associated with ungual fibroma, which is flesh-colored lump emerging from nail fold. Ungual fibroma is flesh-colored. Ungual fibroma, flesh-colored lumps emerging from the nail fold, flesh-colored lump emerging from the nail fold. Okay, tuberous sclerosis. In tuberous sclerosis, there is hematomas. First, hematoma in the skin and the CNS. A for ash leaf spot. A for ash leaf spot. M for mutation in the TSC1 and the TSC2 gene. Mutation in the TSC1 and TSC2 gene. Another A for angiofibroma in the of the malar region. Angiofibroma of the malar region. R for rhabdomyoma. T for tuberous sclerosis. O for it is autosomal dominant. M for serial MRI. M for MRI of the brain. Serial MRI of the brain and the kidney. And another A like angiomyolipoma. There is angiomyolipoma. And S for subependymal tumor. S for subependymal tumor. And this A also indicates for autism. And this is the mnemonic you can remember to remember all the cause of the tuberous sclerosis. A hematoma in the skin and the CNS, ash leaf, it is hypopigmented, mutation in the TSC1 and the TSC2 gene, angiofibroma, cardiac rhabdomyoma, tuberous sclerosis, it is autosomal dominant. It is and a serial MRI of the brain and the kidney should be done. And another is autism and behavioral disorder. Autism and behavioral disorder. There may be Sjagren's patches. There may be subependymal tumor, Sjagren's patches, subependymal tumor, and surveillance tumor screening, regular skin and eye examination, serial MRI of the brain and the kidney, baseline echocardiography and the serial ECG, baseline E electroencephalography, and neuropsychiatric screening. This is angiofibroma, also known as adenoma sebaceum. Angiofibroma. This is ash leaf hypopigmented macula. This is tuberous sclerosis, subependymal nodule. This is subependymal nodule. Tuberous sclerosis, subependymal nodule. This is the Sjagren's patches, patches of the localized lethargy, thickening. Neurologic impairment is the leading cause of death in patients with tuberous sclerosis. Uncontrollable seizures, aspiration pneumonia, and obstructive hydrocephalus can result from progressive central nervous system involvement. Now, von Hippel-Lindau disease. Von Hippel-Lindau disease is, remember, HARP, hemangioblastoma, angiomatosis, renal cell carcinoma, and pheochromocytoma, cerebellar and retinal hemangioblastoma, angiomatosis, renal cell carcinoma, and pheochromocytoma. There is mutation in the VHL chromosome norm 3 VHL. So three word chromosome 3. It is also autosomal dominant. And in here, surveillance, eye examination, eye retinal examination for plasma and urine metanephrine for pheochromocytoma of the brain and the spinal cord, for cerebellar hemangioblastoma, retinal hemangioblastoma, MRI of the abdomen for renal cell carcinoma, and tumor resection. Then Sturge-Weber syndrome. Sturge-Weber syndrome. The mnemonic The name says it all. Sturge. Sturge is stain. There may be port wine stain. There may be tram track calcification. Tram track calcification. It is unilateral. It is unilateral. Or this is unilateral. And G4, there may be problem in the GNAC gene. There may be glaucoma. There may be glaucoma GNAC gene. There may be glaucoma. There may be GNAC gene. And intelligence, intellectual disability. There may be intellectual disability. And S for seizures. There may be seizures. Sometimes epilepsy may be seen. There may be seizures. Mm, and there is leptomeningeal capillary venous malformation. MRI of the brain with contrast, MRI of the brain with contrast to do for diagnosis of the Sturge-Weber syndrome. Laser antiepileptic drug, and intraocular pressure reduction. So ipsilateral choroidal plexus enlargement, and this is the leptomeningeal enlargement, ipsilateral choroid plexus enlargement, ipsilateral choroid plexus enlargement, and there is leptomeningeal enlargement due to venous congestion from capillary venous malformation, leptomeningeal enhancement, and ipsilateral choroidal plexus. This is the tram track. This is the tram track calcification, port wine stain. This is the port wine stain, tram track calcification, port wine stain, tram track calcification. This is the ipsilateral choroid plexus enlargement. So this is all about neurocutaneous disorder. It's a very high L topic. Hope you enjoy.